self-play, pretend play, these are very, very important milestones because they talk about inner language.
What we should keep in mind at that point is the child is only receiving language. He does not get an opportunity.
We find that those children have very low muscle tone, and this leads to writing problems because
is he able to latch on to things that are there close to him and try to talk to the toy? Early intervention is recognizing and identifying that the child may be facing some difficulties in any of the developmental areas, and the parents and the teachers are the first ones to recognize this. They are able to pinpoint and say that there could be a delay in either of the milestones because they are following a chart where there are specific milestones that the child needs to have achieved at a particular age. Of course, there could be a 6 months overlap here and there. However, it is essential that the child follows a particular milestone in his growth pattern.
milestones essentially are, before we move on to what exactly milestones are, we need to speak about where all are we looking for these milestones. So, for easier understanding and for easier comprehension, we typically divide the areas of development of a child into 8 different areas. And we look for specific milestones in each of these areas. Some milestones include, physical milestones like birth weight, how much weight is the child gaining, how is the child developing physically, height and things like that, growth milestones. Then there are motor milestones in terms of when the child turns over, when he holds his head up, when he or she begins to crawl. And we look not just for whether they achieve these milestones on time, we also look for whether, sometimes they skip milestones, sometimes they delayed milestones, sometimes they achieve the milestones, but despite engaging in that activity for long enough, it is not complete. There is no fluency in that. So, milestones also extend to speech, they extend to emotional development, they extend to a child's social development. So, we look for milestones in all these areas, and when there is a lag and when we find there is, despite the child being given the right exposure, given the opportunity to develop, this doesn't happen. That is what we call a red flag.
Early intervention starts right at the time when the child is born, starting with the APGAR score that is taken in the delivery room. APGAR score is taken twice, once as soon as the child is born, and then again it is taken about 5 minutes after the birth. And even in those 5 minutes, there is a specific development that should have happened, and that gives a precursor to any difficulties that the child might face. And this is the time when the pediatrician who is present in the room along with the gynecologist will suggest services that the child might require. It could be speech, it could be audiology, it could be anything. And these precursors could be as simple as birth cry, color of the baby, how he is responding to a tap that he is given. So there are many precursors that the doctor looks at, and it is very medical.
See, there could be indicators in the womb. There are tests available to check for Down syndrome, scans and blood tests available. Now with all the 3D scanning, even the facial features they are able to see, they are able to identify. But these are, there is not much intervention that can happen at this stage unless there is, at an early stage of pregnancy, there is an anomaly scan that the parents go through. That kind of intervention is possible, but those are more intrusive. Any intervention in vitro becomes intrusive. So typically when we speak about in our terms, early intervention begins as soon as the child is born. And of course, as educators, we can't do much at that stage, but the information that we get about the birth history of the child becomes very valuable for us when we are trying to identify if the child has any specific difficulty. High risk families are families where there are various kinds of risk, of course. When we talk about specifically about SLD, high risk families are families where immediate family members of the child have been identified or not, maybe sometimes not identified, but who have a learning difficulty. Those are high risk families. You also have factors like premature birth that affect, so that becomes also a risk factor for a child. Factors like social factors also, like the social emotional factors, the emotional health of the mother also is a risk indicator. That is also a red flag. If the mother has had any kind of drug or alcohol abuse, again becomes, essentially it points to any possible birth trauma that the child could have faced either at birth or when the child is in the womb, that has affected the nutritional levels of the child, that has affected the when the mother is emotionally unstable or is highly emotional during the pregnancy, she generates certain hormones and this is going to affect the child. So the child is going to be, at birth itself, going to come with high levels of adrenaline because the child is used to that. So that kind of stimulation the child is used to, that is going to affect brain development, which will in turn, we don't know what it's going to cause, but we need to be on high alert.
So you can look out for if the child is turning over at the right time, is able to hold up his head by the time he is 3 to 4 months, is he crawling, is he able to look at you and smile at you, is he able to latch on to things that are there close to him and try to talk to the toy by himself. Even in the first 3 months, it is expected that the child is able to look at a toy and just self-talk to the toy. So these are indicators right at the time, even before the child is about 6 months. Once the child is about 6 months, is he able to sit up without support or by himself? Is he able to hold some furniture and stand up on his own and then start walking on his own by the time he's about 1 year? Those are the milestones, motor milestones that parents can look for. The speech milestones that the parent can look for is the child able to understand what is being told to him in simple language, that the mother will say, okay, do you want to have mum, or do you want to come to me? Can I carry you up? Or if she is going to be playing peekaboo with a child, is she able to if the child is able to understand? So these are markers for the receptive language, the motor milestones that the child is achieving on time. And this becomes a very important part of the case history as professionals that we take.
Like I already mentioned, milestones are indicators for us, professionals, as parents, as caregivers. They are indicators that the child is developing the way the child is supposed to develop. What happens when a child misses a milestone? There are certain milestones which, compensation is possible. But let's take the example of the crawling. Okay, crawling is a very, very important milestone for all children. There are many reasons children don't crawl. Some could be because there is an inherent problem, hence they don't crawl. Some could be because they have not been given the opportunity to crawl. They've always been carried or they've always been, on a stroller, whatever it may be. So, in case the child has not crawled, let's look at what actually happens when a child crawls. When a child crawls, the child is forced to use both sides of the body simultaneously. And you also have a cross crawl that happens, which means when he is using the right leg, he is using the left arm, and the opposite. When it's the right arm that moves, it's the left leg that moves. So this causes for what is called a midline crossing, which means we will have to imagine like the latitude and longitude of the earth. The human body also has the latitude and longitude. You have the vertical milestone and then you have a horizontal midline, right? The vertical midline right across from the brain. The brain is in two hemispheres. So it starts there and goes across, it continues into the body. Similarly, here it's between the torso and the lower part of the body. So this milestone, this midline needs to be crossed. Only when this midline is crossed, two parts of the brain can actually communicate with each other. And everything that we do happens only from communication within the brain. Only when one part of the brain communicates with the other, then messages are going to be passed around all over the brain, because it's not like the left brain takes care of the one side and the right brain. You have different parts of the brain. You have the two sides of the brain and then you have different lobes, which is split. One you have the vertical split and then you have the horizontal split as well. So there has to be, lots of communication, lots of traffic jams that are going to be happening inside the brain. And for this smooth flow of traffic, smooth flow of communication, the midline needs to be crossed. And the midline crosses, when it is physically crossed, it crosses in the brain. So when the child does not have the opportunity to crawl, this midline doesn't cross. And for midline crossing, only if the midline crosses, we can even do something as simple as reading. Because even reading goes from one part, one side to the other. You move from the left to right. So if your left eye has to move, and they have to move simultaneously, your eyes. Your brain also has to communicate simultaneously. So if you typically find people for whom the midline hasn't crossed, they either will read only one part of a page, or you will find that they'll move their entire head to read. So it's not static. The head doesn't remain stable and just the eyes move. So something as simple as reading requires the midline to cross. And even for everyday activities, we need the midline to cross, right? Even to zip a backpack, the child needs the midline to cross. So very typically in very young children, this midline crossing happens over a period of time. So by the time they are in grade 1, the midline should have crossed. By the time the child is, say, 5.5. So if the midline has not crossed, you will find that children will use one hand to zip up to the middle and then they'll take the other hand to zip to the end. So that is a very clear, very simple indicator that the midline has not crossed. Now, can the midline not cross despite the child crawling? Yes, that could also happen. But if the child has not crawled, you can be sure that the midline crossing is going to be something of concern.
So we have children not sitting at all. One fine day, they would just try to stand on their own. They would be doing a commando crawl. They will try to stand, and you will find that they have a lot of vestibular issues in the process, or they have been using the walker for so long that independently trying to stand on their own holding a furniture would not have happened. So those are the skipped milestones that we look for in the motor milestones. The other milestones that we think can get missed are the speech milestones, where the child has not really cooed, has not made enough sounds initially, and that leads to a lot of speech difficulties in the child as they grow up, because they are not able to articulate appropriately when they speak. And there is a fluency in speech that could be a concern for reading, writing, spelling later on in their primary education life.
One of the missed milestones that we can talk about is, again, I'm going to go back to crawling because that is a very, very important missed milestone. When the child has not crawled, the commando crawl, that is crawling on your stomach, right? Like a commando, you crawl like this. So that is a very important milestone to build strength in the child's shoulders, okay? This part of the shoulder. And we find that children who've not done much of the commando crawl or who've missed it or who've done it little awkwardly, we find that those children have very low muscle tone. And this leads to writing problems, because writing we often think is something that you do with your fingers. So when you sometimes talk to parents and say, the child needs some help in writing, or even sometimes in schools, they'll say, oh yeah, we're doing a lot of fine motor activities. Yes, fine motor is important. Finger dexterity is important for writing. But writing is something that involves much more than just your fine motor skills. It involves more than just your fingers. It involves your wrists, it involves your forearms, it involves your biceps, your triceps and your shoulder. And only if your shoulder is strong, you have what is called the dynamic tripod grip, which should develop by the time the child is 6. And the dynamic tripod grip is using these 3 fingers to hold a pencil and being able to mobilize the movement of your wrist. And for this wrist stability to come, the shoulder has to be strong. So that milestone we found in many children who have missed the commando crawl, that writing milestone is something, writing is something that they find hard. It's not like they cannot do it, they can do it, but they get arm pain, there's fatigue because the muscle tone is not fully, it's not how it should be.
So the best thing that they can do is, if the child is 2.5 plus and they have started noticing these indicators, there is a lag in these indicators, would be to approach professionals like Madras Dyslexia Association, and we in turn can guide them to other professionals if it is not in our scope. And if the child is able to, has started understanding conversation, or rather can I say, has started getting to understand receptive speech, then we also can do a functional assessment for academics or for the pre-skills required for academics, and we are able to help the child with the correct professional help that they would require.
Something that parents can do when they start observing these, they find that their child has missed 1 or 2 milestones, or, is struggling with certain skills, is to first engage with the child. That's very important. I think a lot can be done in the house, within the kitchen, within what is available. Of course, we have professionals, but I think the first thing is to change currently what they are doing, right? So, is to engage with the child, give the child lots of opportunities to play. Play is, physical play, like going out to the park, going to the beach, running in the sand. These are things that they're rare for children these days, right? So, they need to do this, they need to engage with the child, and of course see a professional. When they find that they have engaged with the child, still there are problems, still they would need, intervention, then definitely approach the professional.
So when we speak about play, it is also important for us to see how the child is playing. It has to be automatic, it has to be child driven, and he should be willing to run around and play outside. Or even at home, if the mother is engaging with him, he should be willing to participate in the activity. So this has to happen very fluently, and there should be an automatic interest that gets evoked from the child within him, so that learning also can happen in the process.
Educational tools are okay. You can use them, but they are not accessible to all parents, right? They come at a certain cost. They come at very hefty price tags. So, there is a lot that can be done just with traditional practices, with things that we've been doing for hundreds of years. You don't need specialized toys. You don't need some advanced reading system for children to be able to read. Okay? And in fact, early intervention begins traditionally in India. We have a rich culture of early intervention. We have things that are required for a child to develop in the right way is already part of our system, starting from, when we put them in the tuli. That is all the vestibular support that they need in the early stages. Starting from the bath, the traditional bath that the grandmothers will put them on their legs in a slide-like position and bathe them, right? That gives them all the vestibular and the proprioceptive help that they need. They are flipped over, they are, they are massaged. Massage itself, the oil massage that they receive as newborns helps in building muscle tone. And all the games, eating pottukadle, eating puri, these are all fine motor skills that the child is developing. So they are enough. You don't have to you don't have to buy Play-Doh. You can just give a child chapati dough, right? So these things they're not expensive. You don't need fancy sorting toys. You can give rajma and chana and ask the child to separate. Of course, books are good. You need to introduce children to books at an early age. However, you don't need to do any advanced, very fancy things for children to develop. It's their job to develop. It is their job to learn through play. So when they play naturally, when they are exposed to natural environments, they spend a lot of time outdoors, these things happen. And development, there's no hurry to make a child write. There's no hurry to make them know all the letters of the alphabet or know tables when they are 4 years old. That is not what we mean by early intervention. By early intervention, we mean offering the child support to develop the way they should develop naturally.
It is also very important that the child gets into pretend play. And that typically starts in the kitchen when the child walks into the kitchen with a mother. He starts playing with the vessels. He starts with understanding, he starts with role play. He starts understanding mathematical concepts because he is sorting and categorizing vessels. When he drops vessels of different material, he realizes that it makes different sounds. So there's so much that is happening just within the kitchen. Also during bathing time, when the child is playing with the mug and the little cups that are there in the washroom itself, he is learning a lot of estimation skills. So these are all, it just comes naturally to the child. We don't really need to teach him. So early intervention only happens when the mother notices that these are not happening automatically.
Typically, if you have offered everything for the child to develop in a natural way, and you find that at around the age of 3, we would say 2.5 to 3, this is as far as academics, I'm talking about academics, I'm talking about SLD, at-risk children who may be at risk to dyslexia. At about 2.5, 3, which is the stage where there is some formal work that begins. They start little bit of reading, they start little bit of writing, coloring. So when that stage has begun, the child has received a lot of input, yet you find that the child is lagging. You find that, there is a lag of more than 6 months, and that when you look in the class, that there are other children most children are able to achieve what they are able to achieve with ease, and your child is struggling. Very, very important is it has to be despite exposure. You have exposed the child. See, for example, one of the things that we ask parents is, does the child feed himself? Is he able to eat by himself? Say, when we ask a 4-year-old this and the parent says he cannot, the next follow-up question has to be, have you given the child the opportunity to eat by himself? Because as Indians, as much as we have so much wisdom in many things, letting the child self-feed is something that we don't. We find even 12-year-olds being fed by their mothers, right? So feeding itself is a very, very important. Self-feeding is again a very important area in development, which sort of takes care of so many things, and that itself is an indicator of so many other problems, because it involves eye-hand coordination. It involves the child being able to tell if they are hungry, the child being able to understand whether they are feeling full, right? So that itself, so feeding, for example, when you have not given the child the opportunity, and then when you test, it comes out, flipped. So very important that the child has been exposed, has been given autonomy, has been given the opportunity to try something, and for 6 months at least. And this has not happened despite these things, and the child is not developing. That is when you look for help. And of course, the school is going to tell you.
So this comes from your internal signals that goes to the brain saying that, the child needs to visit the washroom, and he indicates that it could be a gesture, it could be the way he kind of crunches his face. It could be many of those indicators that the mother can look for and take him to the washroom. But in spite of trying to potty train him, if the child is potty training milestone should be achieved by the time the child is about 2, but taking the child to the washroom at regular interval is something that the mother should or the family should encourage the child to start doing as early as when the child is 1. So this is part of the signals, the internal signals that the child receives, and it is part of the interoception, which is part of our sensory system. Which tells us that we want to visit the washroom, we are hungry, we feel pain in our stomach, so we feel happy, we feel sad. So these are the indicators that come from within, which the child should be able to recognize. If the child is not able to recognize this aspect of getting potty trained, it becomes a red flag. The reason being, later on, it could also lead to the child not understanding his social emotional feelings. And that leads to other difficulties where he may not learn the social language, he may not understand the social cognition that is required, how to behave with his peers, and then he gets isolated because children don't want to accept somebody who is not behaving in the appropriate fashion. So this creates a lot of difficulty for the child. Hence, this becomes a very important aspect that parents have to note. It can't be that, keep him in his diaper through the night all the time, even when he's 4 and 5, then there is a difficulty because the child on his own naturally should not want to wear the diaper.
Self-play, pretend play, these are very, very important milestones because they talk about inner language. How the child is talking to himself, what is internally. See, intrinsically it comes, and pretend play also helps with a lot with language development. Okay, so when the child is, and of course cognition as well, because the child is looking at the environment, he's looking at his mother. Okay, then he say, I'm going to play kitchen. Or you look at a professional you go to the doctors and then you want to come home and you pretend like you are the doctor. So there's a lot of internal talk that is happening, and that is very important for language development. Okay, and also cognition, like I said, because you're understanding cause and effect. You're understanding, obviously you're pretending, so you may not have all the apparatus available. So you think a pen to be an injection, or you think of, creativity develops because you are substituting objects. And then so much of socializing also comes because the child will not only, when he's playing kitchen set, will not only cook, but will also go and offer everybody food. And they understand that, when they play, say, you give them some chapati dough, and then they're playing kitchen set and they say, I'm making a laddu for each person. Then there is also a little bit mathematics that comes. So I have 5 people at home, I make 5 little balls and offer it as laddu. So there's lots of play itself, and particularly pretend play offers a variety of developmental opportunities for the child, particularly in cognition and in social skills and language, of course.
So when the child is exposed to a lot of gadgets at that time, obviously it is very stimulating and the child is going to be looking at the screen all the time. What we should keep in mind at that point is the child is only receiving language. He does not get an opportunity to speak or communicate at all. And that we find of late, which we are facing a lot of difficulties in children, is they are not able to articulate. There is no fluency in speech in the process. Their vocabulary, they know the vocabulary, but they are not able to articulate it or speak it. So this creates a lot of issues when it comes to academic readiness in the child. They are also not, they don't socialize at all. When children are in front of the screen, they are not socializing. So there again, we find that the child is facing a lot of difficulties, and that in turn leads to a lot of emotional issues in the kid. Also, there is also problem with cognition, because since the child is not playing by himself, he is not able to self-experience everything and learn it his way. And hence the perception is always what the screen is showing him rather than learning it through his senses.
As much as we talk about early intervention, early awareness, knowing milestones, there are many ways of recording milestones. Now you have journals. In the olden days, when the child crosses over, they'll make a sweet, they'll make a laddu. And when the child starts teething, they'll make murku to give the child to teeth. So there were rituals in those days. Now you have, very, very fancy books to record milestones. So one thing is to be aware when they deliver the child, even before you deliver. Many parents, many expectant parents are very aware these days. Sometimes too much. But when you go to a professional and they go for Lama's classes, they go for prenatal yoga, they learn about birthing. There's so much of awareness and education about choices of birthing. So along with that, a little bit of what to expect in the at least first 10 days. And what can you offer in terms of what should the child be offered in the delivery room, in terms of, intervention, in terms of how should the child develop, what should be the typical milestones. A little bit understanding of that and cognizance of that goes a long way. And remembering these details, because you have to, if you're not going to remember it, you record it in some way, having this information, because you don't know when this is going to be useful to you. So I think that is one very important thing for young parents of young children to, record these milestones in some way. And they're going to be a wonderful memory as well, right? So record it. You don't know when you're going to need it. And when you find that, your child is skipping a few milestones, or there are some delayed milestones, don't panic, okay? Because at this stage, the first 5 years, any intervention that we give is going to work very quickly. So there's no need for panic. You need to be calm, yet you need to act. You neither ignore it nor do you panic it. There's no point over-diagnosing a situation. But if you find that, it sounds a little off, but when I say the parental gut, the maternal gut, the instinct, it will tell you that, this is something that I need to worry about. Don't ignore that. So, and go for intervention as soon as you can and go to professionals. Don't, go by fancy tags, and go to a seasoned professional. Your pediatrician will be your first point of contact. Go to your pediatrician, see if there is something that you need to worry about. If you find the pediatrician is not giving you enough answers, then there are lots of organizations that offer early intervention. Go to somebody, but do not panic. I think that is something, because at the end of the day, we get asked this. So do you intervene at 2.5 itself, at 3 itself? Will that not cause panic in parents? That is a message we want to say. This is only, information is knowledge, but there's no point getting panicked about it and, overreacting or over-diagnosing a situation. Do not use Google Doctor. Google is going to give you some answers. Google is going to help you identify these milestones, but Google is not going to give you solutions. You need a real human being to give you solutions. So go to a professional.
Also, as a family, it is important to engage with the child. And it would be a smart thing to draw up a schedule where, when it is convenient for the child to play with you, to mark that time and play with the child regularly, engaging him in conversation, pretending to be the roles that he is playing, going down to the child's level. We find that a lot of families these days are in front of the screen and, they just tell the child, okay, play with the blocks. But then how much is he going to play with the blocks by himself when, there is nobody engaging with him? So it would be a great idea to set a schedule where you are engaging with the child and helping the child develop holistically in the process. And this also gives an indicator to the parents as well as to the family members who are living together that the child is finding something difficult. Why is the child not learning in spite of we teaching him or engaging him in that activity every day in a regular fashion? Those can be the indicators that can help the mother, help the father realize that they need to approach professionals and do whatever is required so that the child is helped as early as possible.